with us today, so we're asking Kirk Irby to stick around. And previous segment, we talked about how the supply chain issues are affecting the pharmacy business. You mentioned something before we went on the air, controlled substance prescriptions.
Yes.
Now, the first thing that popped into my mind was the store on South First.
Yes.
But that's not what we're talking about. So when you say controlled substance prescriptions, what are we talking about?
Mostly it's opiates. Sometimes it's like, your Ritalin and Adderall, some of the what they call ADHD drugs. Those are all controlled substances. Suboxone is another one. And Suboxone's a drug to help people get off of street opiates, and it kind of helps them to replace the heroin or whatever else they've been using with something that's a little less addictive, but kind of helps satisfy that addiction, so they can kind of a step down drug type thing.
Mm-hmm.
And then they can hopefully go ahead and get off of the Suboxone after they've been on that for a couple of months or so. But those are all different controlled substances, and we're being limited on what we can get on a monthly basis from our wholesalers by the DEA. And right now, we're not able to take on any more regular patients. Now, if you have something that's, you've been to the emergency room or you've had surgery and you need like a week's worth or 2 weeks worth of an opiate painkiller, we're still able to do that. But the on general, what we call maintenance drugs, which is a drug that somebody gets on a monthly or a quarterly basis, and generally that's going to be the Adderall or the Suboxone. Some people are on long-term opiate therapy, and those are the ones that we can't take any more people on, because we're already pretty much at the max of what we can order from the wholesaler. So not only do we have supply chain issues, we have this limit on certain types of medications that we can buy each month based on DEA regulations. And it's kind of like I've said before to other people, I'm kind of never thought that I would be in a spot that I would have to turn away business just because I didn't, you didn't want to help people out or whatever.
Yeah.
But we're limited on how much of different classes of medications we can get.
That's amazing. And so you've got a patient that wants to transfer their prescription, and you have to tell them that you can't. You're full up. So what is fentanyl? What classification or category of drug is that?
It fits into the opiate category. It's considered a synthetic opiate. It is typically only used inside the hospital and mostly during surgery, or maybe outpatient surgery. They do make patches that are supposed to last 3 days that will release a small amount of fentanyl, and these are for chronic pain patients that have already been on some kind of oral opiate that either they couldn't get the relief, or it's considered, the term is that they've failed on oral opiate therapy. So I kind of hate to throw certain terms out there when it might not mean anything to patients,
Sure.
the general population. But that's typically what the fentanyl patches are for, and it is a much more potent opiate than what you can get otherwise, in hydrocodone or oxycodone.
Mm-hmm.
So a smaller amount of it will produce more of the opiate effect. And the kind of the end result is that can cause a depression in your breathing to a point where you stop breathing. And that's
Wow.
where what the fentanyl deaths are mostly related to.
Is the exposure to enough, and it doesn't take much,
It does not.
but it's exposure to enough that it has that kind of effect on folks. You wonder about cause and effect. There's been so much concern over the Oxycontin and other
Yes.
opioid addictions and abuses of those drugs. And then you've got the battle between the patient and the doctor. The patient wants more, and the doctor's like, no, you've got enough. And so you've got those battles going on. And then you've got all the other DEA restrictions that are going on. So you wonder if the explosion in the illegal fentanyl trade is in part a result of the governmental restrictions on the access to the other types of opioids.
I think part of it is. I have also saw a report that, and I hadn't thought about it this way until the report kind of, kind of got me to think this way. But as the different states are legalizing marijuana in certain ways, whether it's just medical or where it's recreational, the drug cartels from Mexico that used to be their bread and butter, as I understand. That's what this report had said. And as that has dried up for the drug cartels, they have been switching to fentanyl, and they have also been lacing some of their marijuana with fentanyl to give it a bigger hit or whatever. So
don't buy the stuff at the store. Keep getting our stuff, illegal stuff, because you're going to get a bigger whatever.
And
wow.
it's cheaper, but it can be laced with fentanyl. So, and it's just different ways, and it's this kind of what was kind of presented to me was this capitalistic market type thing that the drug cartels are doing, and they're being hurt in one area, so they're switching. And some people are saying that they're getting the raw ingredients from China, and that China's very open and helping these places to get the raw ingredients so that they can cook it or whatever that process of making it is. And China's happy to send that stuff because they know it's going to wind up in the United States. The drug cartels are trying to increase their profits, so to speak, when they're being hurt on the marijuana side. So it was just kind of an interesting report to listen to.
It sure is, but it's another factor when you combine it with all the other things that are going on that is having an impact on availability of certain types of drugs and so forth. And it's an interweaved and intertwined. It's not a cut and dry. I mean, there's all kinds of factors that are involved in these things.
That's true, and it would be easier if it was cut and dry, but it's not.
Yeah.
And you get national politics that plays into it, like with the open border. It does make it easier for those people to get the illegal products from Mexico up into the United States.
Unfortunately, that's just a reality of the situation when you've let 2 million people into the country without any kind of real screening that goes on. I mean, they're catching some, but it's so small a percentage compared to what's really coming in. And it's not just your family trying to improve their life. It's Guatemala and Venezuela and other countries emptying their prisons, emptying their psych wards, getting rid of the undesirables, or controlled by the cartels,
Yes.
that are doing the human trafficking and the drug trafficking and the things like that. And this is my opinion, of course, but that we basically have lost control of our border. We don't have a border between here and Mexico anymore.
That is my opinion too.
Yeah, and so it affects things like what we've been talking about in this segment. Flu shots, have we gotten into the flu season yet, or is it still plenty of time for folks to get their flu shots if they want to be ready to go for this season?
We have been giving them for about 2 months, and we still have plenty. In our area of the country, it really is about the middle of November when the flu season really kicks up. The Southwest is delayed a little bit from the rest of the country, and I think it's because of the warmer, drier weather that we generally have. And so about the middle of November, we're still giving flu shots. Come in, get them. That's still a good time to get them.
All right. Lowell's Pharmacy has flu shots, so that's good to know. You had a clinic here not too long ago.
We did.
Hope some folks took advantage of that.
We had a fair amount. We were doing the COVID and the flu shots, and the CDC plus the New Mexico Department of Health has been encouraging us to, every time we give a COVID shot, to ask them about their flu shot. You can get them both at the same time. There's not a problem with that. And ideally, the New Mexico Department of Health really is wanting us to give a flu shot every time we give a COVID shot.
Okay. Well, that would be their recommendation, but patient still has the say-so so far?
Absolutely.
Okay.
On that.
Well, that's good.
We're not forcing people to get 2 shots if they want one.
Yeah. Just get the one you want, or get them both. It's whatever you want.
That's correct.
You're making it available. So, well, good. Was there anything else we wanted to share with folks today?
That's all that I really had for today.
Very good. Kirk Irby from Lowell's Pharmacy. And again, if you have any questions on the availability of certain prescriptions, the flu shots, the controlled substance prescriptions, anything like that, or any other question that you want to ask, Kirk, my back hurts. What do I need? And your standard answer is drop 20 pounds. But in the meantime, here, this is something that might help,
Yes.
All right.
We can do that.
There you go. Kirk, thanks a lot.
Sure.
See what Jared's got in the way of news for you. Eddie